start with my talk. I am Dr. Nilesh Kumar. I have innovated a DIGS Pro under guidance of Dr. Ashish Sharma. And I am going to talk about how you are going to find your germinal idea. So these are my financial disclosures. So just to give a brief introduction what my innovation has been, it is a completely slit lamp independent, world's first smartphone based gonio imaging device. So it just uses a smartphone camera, there is an optics in the housing, and then there is your gonio lens, most compatible with 4 mirror and 6 mirror, but works with 2 mirror and 3 mirror as well. And it is compatible with all major smartphones that are available. So this is how it is set up for use. You just take a gonio lens, screw it into your adapter. That adapter is perfectly aligned with the housing segment, so you don't have to be bothered with the alignment. Just open your camera app, and then you are set to go. And this is how you acquire the image. Just as a normal gonio lens, you put this with the housing, and on the patient's eyes, just ask the patient to look straight, align it, and click it, and you get a complete 4 mirror 360-degree image using 6 mirror, and are nearly 360-degree based on the 4 mirror. So these are some sample images. You can see open angle, you can see peripheral anterior synechia, and you can see silicon bubble, all imaged with DIGS Pro. These images are using 3 mirror gonio lens. But the main question is, how did this happen, and how does anything happen? We get a lot of idea. The most two common questions asked to any innovators are, how did you get that idea, and how did you decide to take it forward? I will try to answer those two questions in today's presentation based on my learning from my interaction with other innovators. So everyone has got ideas. When presented with a problem, any logical mind will give you a solution. So anyone in the audience who wants to innovate, focus on finding that problem. That is the key point. Focus on finding the problem that is very close to you and that you really want to be solved for yourself. When you find that it is for yourself and you want to solve it, you will take it forward, and then your brain will do the magic. So my problem was convincing the patient that they have closed angles and they needed YAG PI. It's a very difficult thing to explain a patient that has walked into your clinic just to get a refraction and tell them that, okay, you are supposed to go blind if you don't get this procedure. So it bothers them. They are suddenly worried that why this doctor is telling, and they might also think that this doctor wants to make some money out of me by doing a simple laser. So the only way to convince them was to show images, and there was no viable solution to show them their angle. So I just wanted to solve that problem. What did my brain throw up? What is a gonio mirror? Is it a normal mirror? Don't we all take this? In gym, we take gym selfies. What is it? We are just imaging a mirror. Similarly, can't we image a gonio mirror? That was the solution that came into the gym. This is my college gym. But it is not that I just got an idea in the evening and next day the DIGS was born. It took me 8 to 10 days to gather the courage to take the first picture. I took that patient in a dark room. Nobody was there. I was clicking the image. First image when I was clicking, Dr. Ashish Sharma walks in and is like, what are you doing? And that even before DIGS was born, he walked in, he was like, what are you doing? I told him, sir, this is an idea that I have got. And he got so excited, he was even more excited than me. And then he's like, we have to work on it, and then the journey came forward. So Ikigai is a Japanese philosophy, the reason of being. Why I'm telling this, because if you have an idea and you have a solution, then you have to go the Ikigai way. The 4 questions are, do you love what you are doing? Are you good at it? Does the world need it? And is anyone willing to pay for it? These are the 4 questions that will answer what way you are going to take forward. So 2 questions are answered. Do you love doing it? You have a problem that you want to solve, so you love doing it. Are you good at it? If you have solved, you are good at it. So these 2 questions are solved. Now you have to do a survey to see if your world needs that idea, or is it very pertinent to yourself. If it is only pertinent to you, then don't take it commercial, but show it to everybody that this is a solution. Maybe few people might need it. So that is the way, and you can go the DIY way. And If anybody is willing to pay for it, take it commercial. If you think that this is a problem and the solution is for 10 lakhs, you are giving it for 1 lakh or 50,000, then just commercialize it. So it took 12 prototype. This is if you love doing what you do, this is what happens. That is the first image that I took. What I was telling about, from first image to get to this image on the center one, it took 12 prototypes. We took 12 macro lenses off Amazon. We pasted it on the smartphone, and we tried different modalities, and we took that center image. The next question to be answered is, are you good enough to implement your ideas? This decides the route that you're going to take to develop your idea. So DIY, as I told, if only you want to do it or few people want to do it, go the DIY. The industry partners comes in when you want to commercialize, and having a mentor is of utmost importance. If you find a mentor, it is like nothing. The journey that uh, generally takes what took Ashish sir around 5 years, it took only 2 years for me, because he has made all the he knows how to steamroll your way into the system now. So it becomes very important to get a right mentor. But it is not that if you don't have a right mentor, you can't do it. He did it without a mentor, so it can also be done like that. Now, to find out, does your world need it? So what we did is a survey, and we saw that there are no viable options available. There was a 3D OCT reconstruction for anterior segment, and it was like prototyping stage, and it costed around 40 lakhs. There was a machine to take from Nidec to take gonio images, that was 25 lakhs. What we did, we wanted to give something for very cheap, 25, 30,000, 40,000. So that provoked us to go further and to go the commercial way. We published the technique in Journal of Glaucoma and the quality of the image was good enough to go on the cover art. So the last question really decides where your innovation needs to go, commercial or not. Simple. Are you willing to pay for it? How did we get to know? Once we published that article, everybody was asking, do you have a device to do this? When we told that no, because the publication was on handheld, it was not on on the device. So everybody was like, do you have a device to do it? Please provide us a device, we are willing to pay for it. So that answered the question. So any research that has to go has to be self-sustainable, so that it pays for itself. You don't make commercial angle out of it, you don't get money. That's why we have kept it frugal and very low cost. So just it pays for itself. We don't take any monetary benefit out of it. That way it reaches to more people, and it helps us to grow further. But should we stop? Now we have a device, it is patented, it is commercialized. Should we stop? The beauty of what you do, and you are learning what you do, is that you are not going to stop even after winning multiple awards. The next frontier is to get a reflection-free image, so that there is no reflection of flash, there is no interference from any outlight. So this is what we are striving for. Apart from this, we are working to get a 3D gonio image camera, so that if you put a stereoscopic glasses on, you will get the angle in 3D. So these two frontiers we are working on. Hopefully in next 1 or 2 years, we are going to achieve these two. And this brings us to the main thing. What you are doing, love your idea. I absolutely love my idea. That is my favorite. And that's why this germinal idea is continuing to grow further. Thank you for your patient listening. Keep innovating, keep translating, keep digging.